Hello, welcome to Revive Health's Daily Briefing Live for May 6th, our 30-minute review of the latest, most important news, resources, and advice for health system marketers and communicators dealing with COVID-19. I'm Jeff Spear, guest host for today. As always, we're joined by Chase Kleckner, Senior Marketing Manager and producer. Hey Chase, how are you?
Hey Jeff, good to see you again.
You too, sir. And today we're also joined by Jared Usry, our Vice President at Revive Health. He's in our strategy department and one of our most insightful team members in the agency. That's right, Jared. Jared's worked with dozens of healthcare organizations to sort through problems with preference, retention, acquisition, and more. Fun fact, Jared's title used to be Creative Technologist, which was one of my favorite titles ever. More than anything, he believes marketing is best for being responsible for what consumers and patients want, but also for seeing what our organizations can mean to people. Jared, welcome.
Hey, thanks, Jeff. Kind of fun to be back, and honestly, to see you instead of Chris. I feel like I get both hosts. It's kind of a great experience difference,
Well, you can rate us. Maybe we'll do a little NPS score on each of us.
Net presenter score? I like that.
You got it. Net presenter score. All right. We'll be talking a lot with Jared today about virtual health, telemedicine, telehealth, and we'll have a pop quiz at the end about those phrases. But as with each show, we plan on covering the latest news on COVID-19, how it relates to marketing communications. We're going to highlight a few resources, which Chase will throw up in the chat function. If you have a question, please use the Q&A button at the bottom of your browser, and Jared, Chase, and I will try to get to as many as possible by the end of the show. You can also use the chat function to talk to each other, but if you've got a question for us, please use that Q&A button. And you can also subscribe to the podcast on iTunes. Just search for Revive Health Daily Briefing Live. We'll post a recording of this episode by the end of the day, and you can visit our website, thinkrevivehealth.com/COVID-19 for that, as well as a lot of other great content, including some consumer research, lots of archives on these podcasts, and many of which you may not have seen before or listened to before, I should say, that are probably very applicable. We cover a lot of ground here. A couple other notes before we get into things. We are not experts on COVID-19, so this is not a place for medical or scientific advice or resources. And we do have opinions for all of you, but we also know that everyone's situation is unique, and in the end, you have to make the decisions that are best for you. Okay, let's dive into some things. We start every episode with the latest count of confirmed cases. So we use the Johns Hopkins tool, and we are at globally 3,691,683 people confirmed cases. In the United States, that's 1.2 million people. And sadly, that's resulted in 71,463 confirmed deaths in the United States. And I think what we also saw in the news is that if you take out New York City, the rest of the country's rates of cases are actually going up. So unfortunately, we're not necessarily flattening just yet, it doesn't seem. And another good resource for everybody out there, New York Times, they posted an interesting article about the death rate, I should say the death impact of COVID-19 state by state, in really looking at what the projected deaths by state would have been based on previous years, month to month, and what it is now. And it's kind of interesting in looking at what they're calling, epidemiologists use the term excess deaths. And you can see where your state lies. In some states, I think there's about 18 or 17 are actually below what was expected. And you can probably chalk that up to things like nobody's driving, so less car accidents, maybe not interacting with people, not getting things like the flu. But of course, most states are above what is projected, and will allow you to at least think about what the impact of this is beyond what the confirmed case count might be. So transitioning from that to some other news, the AHA came out today and said that COVID-19 is costing hospitals across the country about $50 billion a month, issued a statement thanking the government for the support, but saying that's not enough. And our listeners out there know that's not enough. So please take a look at that statement, contact your local associations and government, make sure that they understand the real impact and what you're going through, what you need to really be there for your community. And last resource we'll highlight, Jared brought to us a new resource launched by Epic. Jared, tell us a little bit about it.
Yeah, so Epic has taken the advantages of their many systems on their network, and they have aggregated data from across them, 22 health systems to be precise, and are now presenting insights from across that. So increases in telehealth is something we're going to talk about today, but there's also a whole bunch of other things, decreasing cancer screenings, for example, that are pretty important for those people we know like could have cancer and need to be screened. So some really cool research there. We don't usually get this type of view. Athena had a great program called Athena Insights, I believe, a few years ago, and they could do this at a smaller, more practice level. They had some health systems, but this is a chance to get behind the data of some really big health systems, and I think that's a unique viewpoint we don't always have the chance to get.
Yeah, totally agree. And we looked at it today because there is a report there specifically on telemedicine and virtual care. And that's what we're going to really spend the bulk of our time about talking. It said, Jared, expanded about 300%. Is that correct?
300-fold. 300 times more telehealth visits this year versus last year, which I don't know if I can make sense of, like 300-fold increase in anything in recent history. Like the spike there has to be just math. I mean, the number of providers using it now, it's just massive. So, but it's going to reshape everything, I think, telehealth at least.
Yeah, I think about a year, maybe 2 years ago, we looked at this stat, and the access to virtual health was pretty ubiquitous in terms of managed care or health insurance coverage and a covered benefit. So not necessarily technology in each individual user. But the adoption rate or usage rate was around 2 to 3%. So there's a lot of room there, but let's talk about it. Every health system out there has been pushing virtual care. We've reported before in some of our consumer data, even I think within the first 2 weeks of COVID, we did consumer data, how many people have heard of it. It was pretty low. And then literally 2 weeks later, it had jumped, I think, 15 to 20 points. So what are you seeing? What's your view on this in how should health systems think about virtual care right now? I think there's a lot of facets to it.
Yeah, hopefully we'll hit on a few just through conversation, but I think the first one is that this is out of the box now. Like we've been waiting for this for so long, but like everyone's been talking about it for so long, but like now the gates are open and the race has begun. We're not going to be able to put it back. It's not going to get stuck again in health systems because I think two things have changed. I think we now have provider adoption and consumer adoption. And those two things, like ease of use for doctors and doctors knowing that it's available and that they had to do it because of just reimbursement and being paid for doing visits, actually staying busy required adoption. So this kind of forced adoption, I mean, you mentioned it earlier, but like in 2 weeks, we saw a jump from 58% to 77% awareness. How often do you see awareness numbers across the country change that rapidly? It's so rare. And then not only that, but like 50% of all visits right now happening in that Epic report were actually virtual visits happening. So like this is just adoption that you don't normally see. It changes the whole adoption curve. And that's just kind of it's a trend in modern history, but this is something an unprecedented form of adoption. The great thing is I think a lot of health systems had great pilots in place. They had already thought through a lot of logistics. They already had some technologies. And I think there are some advantages of that administration pulling back HIPAA restrictions on this because it really has allowed that adoption to happen when a lot of systems could not have forced it that quickly. But that's going to lead to a whole lot more change. And like once we've started this, we're not going to stop. But I think that maybe the most important thing is that this is now a new market for all health systems across the entire country. Like what is this new market, right? Like it's a whole new growing beast. This is like Amazon in the 90s. But the difference is the demand's already there and written. But I think there's an inherent problem in that as well. And the fundamental problem is your competitive set just got a whole lot bigger. You're no longer working against the folks in your hometown or in your metro area. Now you're competing with folks across the state. Every licensed doctor in the state can provide services if they're specialized in the right area. And so there's also, I think this is maybe in those moments where marketers can say, we can show up. We can play with all 4 Ps for the first time, right? We can talk product, price, place, and promotion, and not just be the communications arm of the organization catching up, right? We can say, we know markets, we can shape markets, so let's get ahead of this. But that's my hope for us, at least.
If there was ever a time for marketers to be at that table and to talk about growth and market share and protection, it's now. I think, and as well as anything you thought about promoting and marketing virtual care is probably kind of thrown out the window, but hopefully your system has been doing it. There's things you have learned and you can start testing and watching it regularly. So Jared, it's May 6th. What should people be doing the next couple weeks, next couple months?
So I think there's probably the short, mid, and long-term things.
Okay.
I think in the next 2 weeks, you really got to be thinking about what's happening competitively. You need to understand what's happening in the local market. What other offerings are out there? Are they offering urgent care virtual? Are they offering primary care virtual? Are they offering specialist rehabilitation services? Like, what is the level of offering? Or even pre-op, post-op, pre-op, right? Like, all those things are now up and actively happening in your market. And if you don't know what your competitors are offering, you're not really going to have the insight. But I think the other piece, we've been talking about rapid recovery a lot as a firm, and I think this is like a key safety message for hospitals right now. We have virtual visits that will keep you safe. You don't have to come in if you don't need to, but when you need to, we really need you to, right? So you don't have to worry about that first visit. I have a client they're doing screenings. They're setting up screenings ahead of time for COVID-19, and they're actually having people tested before they come into the hospital. They're doing drive-through testing so that before you come in for your procedure, you're all ready to go. We know if you have COVID-19 or not, so we can separate you into the right places. It's a health system doing really fun and cool, exciting new work and using virtual health as the lead in. Yeah.
So they're screening them on virtually, then drive-through, then come in. Yeah. No, I think those are really important things, and just remind everybody, start from your brand strengths too. And where have you been pushing, and how can you channel that in virtual care? But Jared mentioned, are you going to push your specialists? Are you going to push urgent care? Where is the place you can carve out, as well as what's next? Because somebody's coming next for you.
Yeah, and that's perfect, because in the next, if I think that's the near term, those 2 weeks right now, in the next 2 to 3 months, we ought to be launching programs to position ourselves and position virtual health, how our virtual health program matches up, right? And there's a lot of ways to think about this. We can think of it as a gap. So let's say we're a AMC who doesn't really have virtual, or we haven't been able to build an urgent care network, but we're just now launching urgent care. It may fill the top of the funnel gap we've never been able to fill, right, through traditional clinics. It may solve a problem from an access perspective we've never been able to solve for. On the other side, we might also have all the right specialists, to your point, Jeff, that we now need to make sure people know that you can access your AMC specialist online.
Totally agree with that point, because what we do know is that top of the funnel, or kind of initial care, preventive care, diagnostic care, is underutilized in the system, in the country, and people don't necessarily go to the right place for it. So virtual care can be a way that makes care more cost efficient and effective, and leads people to the right specialist or the next proper visit. I think that's a real added bonus.
Oh, I 100% agree. And the great thing is that adoption, those numbers from Epic showed us that adoption is consistent across all age groups. All adults, about half of all visits are coming from different groups. So that means if you launch something, there's a chance to reach almost everybody in that early top of the funnel market. This isn't just a millennial play anymore. This isn't just a tech-centered play anymore. This really is something that can reach all audiences. And then the final thing I'll say is that long-term, I don't want to get ahead of virtual health, because it's something I'm afraid we might start doing, but we have to set the infrastructure up for long-term, for the long-term support of it, right? We have to be able to adjust on access. If we can't let virtual health have the same problems that we've seen endemic in health systems for a long time, or it's going to scar our reputation, unfortunately. And that means making sure we understand how we're going to stand it up, how our experience is going to be different, and a whole bunch of other factors, but kind of being prepared for those long-term conversations.
Well, and long term, if you're a provider with rural demographic, or if you are in the rural area, how's the internet connection and Wi-Fi, and are you working with local companies to expand that access to make sure that this is a reliable service for that population as well?
Though I am on broadband right now, I don't joke you. There's not actually a commercial service available to where I live. The HOA has a business line run out that gives us all of our internet, right? So like, and I'm 20 minutes outside Nashville. I'm not anywhere far, right? But this is a common problem all around, where if we don't have it available, the high-speed internet available, virtual health may very well look different. So, and it may be you have to change your offerings, right? And maybe we have to have asynchronous offerings like text message, or even just regular old telehealth for those calls.
Right. Okay, so let's talk about this. So we know this is here. We know it's got to grow. How should health systems think about positioning virtual health and really targeting?
Yeah, so I think key is like understand your organizational strategy. You've got to know what you're going after in the next few years. If you're going to be a high acuity enabler or a top of the funnel access play, right? Like those are the two big kind of strategies outlined by SG2 recently, some cool reporting. So if you kind of know where your organization's heading, it'll be really helpful to define, do you need to fill some gaps or do you need to play on some strengths? I almost always believe that we can find the hidden gems. We're going to show some creative in a minute with Geisinger did, but they talk about the Geisinger doctors. If your doctors are trusting the community, you better make sure they're at the forefront, right? You better make sure it's about their experience. If people trust you because they can always come into your urgent care seems like a really good leading offer to make sure you start with, right? To keep your brand front and center. The final thing though is with positioning, there's also price. And I think that's something we don't usually get to play with when we talk about positioning. And so we can talk about premium services now versus others, right? You guys have heard of TytoCare. It's a really cool company doing medical devices that are add-ons for your phone. So essentially it has a thermometer and it has a webcam and it has all these great devices, so people can do at-home clinic visits with the right type of instruments. So we see folks like Sanford Health up there in South Dakota, North Dakota, the largest rural health provider in the country, if I'm not mistaken. They have a really active program with TytoCare because they know they just opened up clinics at every smartphone in the country who has that set of tools. So pretty cool ways for you to use positioning, premium price, but also worth it for some of those groups to like free offerings for COVID-19 to drive adoption, right?
Yeah, and if you're an ACO, if you're managing a population and the incentives are there, you provide this to them. Make sure that population has in their home. Encourage that virtual care.
Yeah, I can just imagine the Medicare Advantage provider-sponsored health plans doing this really quickly, right? With these numbers, right. I have to assume they're going to say it's better and faster for us to go ahead and have someone come in virtually than it is not, and do more check-in visits with a whole wider range of services. But we'll see kind of how it evolves, but I can't help but think this has to be an area of investment for them too.
What about the patient experience? I for one, have worked with virtual care companies and telehealth companies for probably a decade, but I have never actually done a virtual care visit. I am doing some remote virtual physical therapy right now, which is interesting. But tell us about the patient experience, Jared, and what you think health systems, particularly if it's something maybe they've wide labeled and not really dedicate a lot of resources to thinking about the experience too much. I think now is probably the time.
Yeah, often we think of, we build big buildings with great experiences in mind, right? We hire architecture firms to build these beautiful buildings, beautiful lobbies that kind of guide patients through and give them some serenity. But we forget that our website and our digital tools, our integration of platforms, those now are going to be the lobby, that digital front door that we're going to be relying on. So the same care and attention we think of that from an architecture perspective really does matter now. So I think first off, digital user experience mapping. You're probably going to run some ads that point to a web page. That web page is going to have a landing page, could have a couple of follow-up landing pages, and it's going to point to an app, and then the app is not going to work with your system, or it's not going to download, right? So you have to think about the many platforms that people are going to have to experience and integrating those and giving people the right expectations for how they're going to come across them. Not to mention the fact when you do patient communications, they're going to be pushing out. And then there's going to be all the wonderful problems we're going to get into with the many platforms we've kind of invested in quickly. Because, with the rollback of HIPAA protections on some of these products to kind of promote telehealth, we know there's going to be at some point probably a rollback of these. And when that happens, we're going to see a narrowing of platforms at a system level. And at that point, it feels like such a good opportunity for us to mold the experience and make sure the platforms we choose as our new norm become really well embedded into the system. But I think there's also some things around, training doctors and making sure that they know how to present in virtual health. I think it's a pretty common one. Almost all the virtual health companies have some resources for it, if you're looking at Amwell or Teladoc or others. But I'd also say there's some key measures, right? How often do people actually use a virtual health a second time? I want to be really aware of, patient experience and HCAHPS here, but there are some really great key measures I think we can start picking up on: length of visit, how long were they waiting, and start seeing that. We can never track those things in the facility. It's so difficult for us to understand how long someone sat in the waiting room, right? I mean, we can get it, but it's often such a pain. With this, we can set it up from the get-go to give us the measures we need and understand what drives the patient experience and what drives them to come back or never use us again, unfortunately.
Well, let's hope it's not that one. But the physician training part, the physician experience and their ability to influence the patient experience, I think is a whole different phenomenon here. We all know doctors, everyone's different, every people different. So some physician might get on and have a background like mine, and some might get a little crazy with a virtual background. How does your brand show up when a physician's got maybe he really wants to be at the beach, or she's really very serene at a lake in the woods, and meanwhile the patient's sitting here sick? I don't know. That could be something to think about. So what kind of services do you think we can provide to the physicians and community providers here?
I think this is like the role of marketing, and I know this is going to sound like a little hokey, but it's where the heart comes in. I think, right, for marketing is we kind of show them what the patient's going through. We find the places where it didn't go well, and we point to and say, hey, look what happened here, right? Like we're giving now doctors this really, really hard expectation. They are now no longer just a doctor. They are the check-in, and they are the nurse who brought someone to the room, and they are the doctor themselves, and they're the ones providing follow-up instructions, all inside the visit. So if we have a doctor in the past who maybe has had some issues with that type of patient interface in the normal moment, they then become all those touch points. So the importance for us to communicate to doctors what patients are feeling just went up a lot. And luckily, I think that's something marketing can step up and do, especially if we get the right type of measures in place to monitor what's happening.
I think you're totally right. We did some research recently around online education and virtual care or virtual education, and some health systems, Arizona State, our good friend Josh Schoonover told me about Arizona State's online program. They've got a whole department that is exclusively focused on patient or student/teacher support for online education to make sure it's really, really good. Everything from, is the curriculum designed well for an online education? Does the instructor know how to engage students properly? I think the same thing needs to happen at health systems. You've got to have that core group of people that connect patients and physicians to each other, and physicians to each other, nurses, clinicians, everybody else, but that are experts in how everybody's experiencing these things. In addition to, similar to what I guess has probably been 5 to 10 years when physician ratings are public and hospitals started posting those for physicians and kind of stoked their competitive juices a little bit, but also had to be there to explain things and then help them improve the ratings, not just good luck, you got a 70. I think though that this is really, really important, and we talk a lot about right now is rapid recovery. We need to get those elective procedures and the surgical procedures and volumes up. Got to do that. But if I'm thinking about the next 6 months and how you open this, how you're capitalizing on virtual care and positioning, growing this market over the next 6 months is key. And that means as a marketing team, setting up your point of view and your team to be able to manage this thing, which isn't going to be simple, but absolutely could be a key to thriving.
Yeah, and I think that means you have to be able to adjust, right? That's probably not to go beyond patient experience, but the key here is to get better tomorrow than we were today. It's not to have it perfect. It's not to launch it quickly. It's to get the pulse of the market and keep getting the pulse of the market. Not to use a healthcare analogy, but I think there's just a really important piece for us to keep on this, because this is not an initiative that I think will fade out in the next couple months and say, oh, health is back to normal. It really is going to go. The market's going to run, and we better be ready to keep up.
Well, it could go that way. It could go back to normal for your health system, right? If your competitors unfortunately move faster and more adeptly.
Yeah. So. But I think that's the scary part for me, because it's going to change the referral experience and like where site of care is delivered. And that's so, because it's all those referring relationships I'm more about losing with virtual health, right? That if they make it just a little bit easier, we know how people make decisions for referring relationships. And if the experience is, 1 or 2 times better, they don't have to drive in, an hour and a half to your AMC downtown in a metro area. They're going to recommend the virtual visit that can kind of get things going quickly, right? And only do the surgery there.
Jared, you've pulled together a few creative examples of how advertising was for this pre and during COVID. Chase is going to throw them up on a screen for our viewers. But Jared, talk a little bit about what we're seeing here.
Yeah, so I think there's some really cool, interesting pieces here. Just to highlight, I think the ubiquitousness of the screen involved in everything kind of does do a little bit of that work, like to say this is what we're talking about. That's why you see it so often, and it's not a bad thing at all. I do think you're starting to see how much messaging is happening with these, right? How unclear the messages are here for these early before COVID-19 telehealth programs. It wasn't the priority, right? It wasn't as maybe important for some. I do love kind of St. Elizabeth over here in the left-hand bottom side talking about Remember House Calls. They're a system based in Kentucky, that northern part of Kentucky, right near Cincinnati. So maybe they have a particular affinity there. I also think the Sutter Health kind of tying it into a health plan message is a little interesting as well. So I will call out Hackensack because we're going to see their example. This is what they had before COVID-19. And when we switch in a second, you're going to see what they had afterwards, which is that second one to the left there. Coronavirus symptoms, $20 doctor video visits. Wow, when's the last time you saw a price in a healthcare ad, right? Like that seems rare to me, at least. I mean, maybe a heart screening would be $99 or something, but this is a really direct way for us to play with price in ways that we haven't. You see Geisinger here. I think this is a really, really good example of creative that kind of speaks to the difference Geisinger has, and kind of also acknowledging the fact that the Geisinger network is available as an integrated health network. But the last one I'll call attention to is probably, or maybe a bad example first, Mount Sinai. Love Mount Sinai. Their response in this has been amazing. But I think this may not be the best example of text ratio in a display banner ad, right? We might want to adjust that a little bit before we keep going. And then finally, I think New York Presbyterian, just some interesting art direction. But I think it does do a little work to catch attention, hopefully, in a helpful way.
Yeah, so for our listeners, New York Presbyterian's got a picture of a phone and kind of 3D image of a building or a hospital coming out of the phone, as if you have the hospital on the phone. I think it's interesting. I'm not sure about having the helicopter and ambulance there. It may confuse people, especially when the message is virtual urgent care. Certainly don't want people to think that they should call for anything. Sometimes you can call 911.
Thank you for the client hat, Jeff. That is that speak I am sure we have heard before. That's excellent client, like hearing the client's voice skills. That's great.
Yeah, I think there's a lot to think about. We're just scratching the surface here, and we'll probably talk about virtual care again. But for our listeners, this is, Jared said it earlier, this is a new market that maybe we've never really faced before, where all health systems are entering a new market at the same time. And there will be winners and losers for sure. And certainly not every health system, maybe this needs to be a big part of their strategy, but I think most, you've got to think about this and you have to have a plan, and you've got to have a team monitoring this regularly and really working with your operational teams, your strategy teams on where do you want virtual care to play? How can you make sure that the referral network is strong, as Jared said earlier? And how are you bringing people in? You're going to have to test a lot of different strategies, digital strategies, messaging strategies, and targets to see who you can get in and who matters. But I think the opportunity is huge here. We're about to wrap. I'm going to have one pop quiz for Jared. Jared, can you tell me the difference between telemedicine and telehealth?
Oh, why the pop quiz last minute? Come on, Jeff. I'll take a stab at this. I'm gonna go with telemedicine is care, telehealth is broader. That's gonna be all the definition I'm gonna give, because I'm sure if I go any deeper, I will be way, way off.
Jared is correct. Ding, 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 ding. Of course, virtual care is now in the mix, but I think virtual care is synonymous with just the doctor to patient visit. Telemedicine is often used for physician to patient. And then telehealth is anything else, texting, remote care, all that.
Yeah, so if I need a heart checkup right now, what would we, I'm just kidding, I don't know. I think that would be
911.
telemedicine, correct? Oh, right.
911. Okay, Jared, it's been a blast. Thank you. And really, of course, not just fun, really important information. Thank you for coming on.
Hey, thanks so much for having me. This is a really cool topic. We're excited to be, I think, in this period with clients, because it feels like this is the time where marketing can make a difference. And I think that's what we all want to be doing.
Big difference. Big difference. That's it for today's show. Chase, as always, thank you, sir.
Absolutely. Really enjoyed it as well.
Great. Thanks, Jared, for joining us. Remember to visit www.revivehealth.com/COVID-19 for today's episode and others, and lots of content, including some of the resources that we referenced in today's call, including consumer research surveys. And please let your team know and others about the show. And all of you out there, hang in there. Keep doing what you're doing. Really important work. Jared is, as you can tell, one of the biggest advocates for you, as am I, for the work you're doing and everything you're doing for your teams, your organizations, and your communities. We'll be here again tomorrow. Chris Bevel will be back, and every weekday until this passes. Talk to you then.